Hi, everybody. My name is Kat, and I am a longtime patient of Dr. Wright. I've been seeing him for my lipedema for the last few years, and I'm now working with his team to try to put out a few videos for anyone else out there who might have similar experiences and really just trying to help you understand my experience, and hopefully that will really get the word out for anyone else seeking answers about their possible lipedema. So in this video, I'm going to talk about what led me to my diagnosis and my experience through that process, but I will create a few other ones following this to talk about my experience with surgery and then the post-op experience and that healing process, and what I went through with that, and really how I'm living my life now. So I am 31. I live in Austin, Texas, and I was first officially diagnosed at 29. I went to see Dr. Herbst when she was still at the University of Arizona. And leading up to that, I had tried everything. I ran a half marathon, which I'm really proud of, but leading up to that, I had done every diet under the sun. I had done every workout under the sun. I'd hired a personal trainer. I ate low carb. I ate low fat. I did keto. I did South Beach diet, did Atkins, paleo, everything. And, I lost some weight, but it was never any sort of transformative weight loss or transformative experience as far as the pain that I was feeling. My whole life, or at least from the time I was 12, I was just used to bruising really easily, used to swelling in my legs, used to having what I thought was cellulite, but was actually really painful lipedema fat. And nothing I did helped. I could lose 20 pounds. I think the most I ever lost was about 50 pounds. Um, but my legs still looked the same. They maybe got a little smaller, but the bulges were still there, the pain was still there, and I had had enough. So I did a ton of research, and funny enough, what led me to discovering lipedema online was search queries about why I could not lose weight around my knees. I have these hideous knees where, they have fat all around them and it bulges outward. And no matter what I do, no matter how many squats I do, nothing changes. So that was my eureka moment. That, for some reason, was Google's key to showing me lipedema information. And I very quickly, I think within the week, scheduled an appointment with Dr. Herbst. That it was a few months out, but I was able to get in with one of her associates, and they put me through a series of questionnaires. I met with some of their nurses' aides and people who helped me get a lymphatic drainage machine, a pump, and they sent me on my way at that point, but I really wanted to explore surgery options. And that is what led me to Dr. Wright. Dr. Herbst actually referred me to him, and I made an appointment again almost immediately. And by the time I got to his office, I was just desperate and excited that there was something that could possibly explain my struggles, but um, just really eager to also get it done, get the treatment. So I made my way to his office. That's kind of my backstory, and everything from there is history. So they again put me through a long series of questions about my experience in my body. I did an ultrasound where they looked at my actual fat and muscle and bones, um, and they officially did diagnose me with lipedema. So that was a 1 day process. I flew to St. Louis from Austin, and I spent basically the entire day with Dr. Wright and his team as they examined my body. And then we started talking treatment options. They explained compression to me. They explained elevating my legs, lymphatic draining, dry brushing, all of these non-surgical techniques to try to help. And then we talked surgery. So ultimately, I did decide to get surgery after going through the non-surgical options, but I'll talk more about that in my next video. And if you do want to look at the options, you can always go to Dr. Wright's website, which is lipedema.net, and there's so much information there about what the techniques are, how to do them, and your different options for surgeries. So I'll just continue to tout that website as just a wealth of knowledge. So if you want to hear more, go to my next video. But until then, feel free to also reach out to me on Instagram if you have any personal questions. My handle is kat.carwick. Thanks, guys.